Hello and welcome to HealthTech Hour on UK Health Radio. My name is Steve Roost, and each week we bring you the best news, views and interviews with the CEOs, leaders and clinicians who are shaping and changing the face of healthcare in the UK and beyond. I'm a CEO and founder of a health tech company myself, and I'm passionate about the people and companies who are changing the world. Before we get into today's show, I'd like to just remind everyone to follow us on the socials, which is at HealthTech Hour, and please follow the station, which is at UK Health Radio. So today sees us returning to another alumni of the NHS Digital Accelerator, which highlights health tech set to transform the NHS. It really picks the best and the brightest. I'm not just saying that because my company is on it, but that is actually true. That's the purpose of the program. We have Carey, who's the CEO of GetUBetter. So Carey, also known as Dr. McClellan, was trained as a physiotherapist, and as part of that was inspired to set up his own company. Now, GetUBetter is, well, I'm sure we'll find out, but GetUBetter, I believe, is the leader in personalized recovery and prevention via self-management support. What does that mean? Well, really, one of the major issues that the NHS is faced with at the moment, which I'm sure we're all aware of, is the fact that, people can't get to the doctors and people can't get to secondary care. And what GetUBetter does is specifically focused on musculoskeletal injuries, MSK, which is one of the biggest problems for the NHS at the moment. It provides people, not just patients, but also clinicians, with a way to manage their treatment and support for those issues more effectively at home or in clinical settings. So, Carey, Dr. McClellan, how are you?
I'm very well. Thank you very much for inviting me onto your show, Steve. Good.
Well, thank you very much for coming. So I ask everyone this as part of the show. It's been a pretty crazy 18 months for the world. But in general, for you guys at GetUBetter, what's it been like? What's the mood in the camp been like over the last 18 months?
Well, the mood in the camp has been incredibly busy. Clearly, there's been significant change and disruption across the whole globe. But from our perspective at GetUBetter, we have accelerated massively the production of our self-management conditions to make them available to support patients across pathways to self-manage. And right now, there is a real appetite and demand to support patients and a real emerging understanding of how technology can be incorporated into health systems appropriately to really support both the patient, the health system, and people returning to work.
Right. And I think what we're going to get into on the show is one of the things, particularly with businesses like yourself, who, I mean, and really obviously the last 18 months has been pretty transformative for everyone, but there are some businesses where they it was a right time, right place sort of moment, and a lot of things came together. But I know that you were doing this a long time before this COVID thing happened, and were being extremely successful at it. So one of the things that I want to understand in the show from you particularly is, what of those conditions that led to this supercharging of a need and a demand for services that you provide do you think is sustainable, as in that those are changes that are here to stay versus what might be a spike around COVID? But before we get into that, as regular listeners of the show know, we divide the show up into three parts. The first part is an origins part, which is all of those things that brought you to be doing what you're currently doing, and where you came from and how you came to be doing all of the awesome stuff you're currently doing. The middle part is all of the incredible stuff that you're doing to change the world right now. And then the final bit, if we get to it, is really what does the future hold for GetUBetter. So let's go back a little bit. And at what point, so you're a trained physiotherapist, and at what point did you know that you wanted to get into physiotherapy or physical therapy, or when did that kind of light bulb sort of moment happen for you?
Well, for physiotherapy, it was always something that I wanted to do from a young age, and so it really was a natural transition for me into physiotherapy. Getting into health tech and physiotherapy is a very different matter. So my career has been as an advanced physiotherapy practitioner specializing in emergency care. So sitting in emergency departments, seeing patients that walk through the door having been hit by a car, had a sports injury, might have ruptured ligaments in their knee. And instead of seeing a doctor, a traditional route, they would see a physiotherapist like me, who's appropriately trained to request MRI scans, X-rays, interpret them, refer patients into the system. Now, I've been doing that for quite a while alongside research, and the research was really into this kind of extended role. How can we use people with the right skills to help the system? And I did a PhD. That PhD was in how you deliver urgent care, how you support soft tissue injuries in emergency departments in the UK. So what is the most cost effective and what's the most clinically effective way of doing that?
Right.
And it was during that journey that I realized that you can combine the physio with a digital technology to actually unlock and support both patients, the health system, and people in the workplace.
And was that because you noticed something, or what? Like, it sort of seems sort of obvious now, in a way, which is like, oh yeah, let's just provide services through people's phones and tablets, and like that's like obvious. Why would we? I mean, it's not to say that there are lots of people that don't believe that that's obvious, certainly within the NHS still, even though it's changing. But like when you were doing that, when you started out in your role and you sort of moved into your PhD, what were the kind of major challenges really for you on the front line in your roles that you sort of, that I guess had tickled things in your head and you were like, well, maybe there's a way we could do that better, or like, how did that sort of flow through?
Well, I guess there's two parts to that. Firstly, there's the clinical role. So being a clinician, seeing patients, you spend your days educating them, giving them the confidence, knowledge and skills to be able to deal with what can be quite a sudden change in their normal life. And also providing very clear explanations about what is normal, what to expect and how to get yourself better and how your journey is going to go. So there's a clinical element to that. I was doing day in, day out, but it was really during the writing my thesis. This was in 2006, mind you. So this was really just on the area where smartphones.
Do you know that it's a great time? I feel like that gives you a great perspective, which I'm sure you're about to, which I just interrupted you about, but it gives you a great perspective, I think, right? Because it's sort of like coming up with an idea to launch a digital platform now is like, well, yeah. Whereas like back, back then, I'm so sorry, I'll let you finish now.
No.
Sorry, please finish. I'm sorry.
Okay, no problem. That's exactly right. So it is quite a unique perspective. So at that point in time, I was writing this 90,000 word thesis to be vivid on, which is a nightmare. But I wrote 10,000 words on what is a soft tissue injury and what is the condition of an injury and how do people go through their journey and how do people get better. And while I was writing that chapter, which by the way didn't make the cut, so
okay.
Chucked out.
It's in the director's cut somewhere, right?
Yeah, that's right. I mean, it's pretty out of date now, but it occurred to me at that point while I was doing the work for that specific part of it that patients experience a condition, and that's a lived experience of a problem from the moment it happens. So an acute injury, an ankle sprain, right the way through to having an ankle pain from an ankle sprain 2 years down the line. And you could map that condition journey and slot in the evidence, slot in the advice, slot in the flow, the clinical pathways, and you could slot into it how that person should interact with the health system. So this idea of them being able to build it was born. So the idea of, okay, we can build, there's potential to do this digitally, as digitally was emerging. But it wasn't until 2013 that idea was mulling around, when really the opportunity, the early days of digital platforms like this emerged. So okay, now we have the capabilities to do this and deliver it to patients. So I set up GetUBetter way back then to build the first thing, and then the obvious thing to do, because it's the most prevalent, it's the biggest impact in long-term conditions globally. I mean, when the WHO, the World Health Organization, they use daily adjusted life years to assess the impact of conditions such as cardiovascular disease, diabetes, back pain, musculoskeletal. And across the globe, back pain has the biggest impact in the long term of any condition. So it seemed like a very logical place to start. So we I set about building this day-by-day condition journey for back pain. Set about integrating into and built a platform around that while still working. I'd hasten to add. So I was doing it. Yeah, and that's how the first iteration of GetUBetter's platform, and that's the timings and how it came about.
Okay, and why was there something? Because obviously from 2006 to 2013, during that period of time, I guess what problems does a digital platform solve within the healthcare system as far as, prevention, injury prevention, treatment, soft tissue prevention, back pain? Like, what were the problems that were pre-existing that a digital solution can solve that couldn't otherwise be solved?
Well, I don't think at that point in time. So it's really after 2013 that the problem of over-treatment, the problem of inefficient pathways, the problem of capacity, the problem that patients have no idea how to manage, or don't have the confidence, often don't have the confidence, the knowledge and skills to manage it, and therefore seek too much healthcare. So we're in a situation where 30% of patients will visit, 30% of GP appointments are for musculoskeletal conditions in the UK now. Is
that consistently now 30% of the musculoskeletal?
Right? So in England, there are 320 million GP appointments a year.
Okay.
So you look at 90 million GP appointments for musculoskeletal conditions.
Wow.
Right?
That's enormous. What's the second biggest bucket? Do you know? Just out of interest.
Of musculoskeletal?
No. Of like GP appointments. If MSK is.
I'm not 100% sure, but I believe cardiovascular disease, diabetes will be up there. So atrial fibrillation, hypertension, hypercholesterolemia, those other areas. I mean, if you look at the NHS plan now, they're clearly focusing on key areas like ophthalmology, musculoskeletal, cardiovascular disease, long-term conditions. So, but musculoskeletal takes a decent chunk of those, and about 20%, I believe, is over-treatment. So, as an example, somebody with back pain has a back pain, and it's very prevalent. They go and see their GP. Back pain reoccurs over a year, and then they go back and see their GP. So, roughly speaking, they'll visit their GP 4 times, quite often for medication, and unfortunately, still is the case. About 95% of patients will be given a prescription for medication.
Is that the first course of action, generally speaking, if someone presents with musculoskeletal issues?
Yes, you come to me and I want to give you something to help. So medication is often what's done. If you can provide immediate access to a locally configured, locally produced, easy to use app that connects patients to the whole pathway and supports them to self-manage, you can reduce this over-treatment. If you give people confidence to manage it, they go to their GP less. Amazingly, you can prescribe digitally instead of pharmacologically. So if you get it right, and I'm not saying it's easy, if you get it right, you can prescribe digitally and reduce the costs and the burden, most probably, of inappropriate medication prescription.
That makes sense. And so was this consistent for musculoskeletal issues? Was it always consistently 30% of GP appointments, or is that shifted, or is that historically constant? I don't know. Are people getting more MSK issues? I don't know. I'm just interested.
I think that 30%, if you look at the ranges, 30% is a number, but it really does range between 20 to 30. So I would say it is static. But what is increasing year on year, and especially over this recent challenges we've had with the COVID pandemic, is emergency care. Patients are seeking health in multiple places.
Because they don't feel like
GP, they go to the emergency department. They don't just go to the emergency department, they go to the walk-in centre. And so that's increasing appointments and unscheduled care.
And is that, and sorry, go on. No, I was going to say, and is the mindset there, is it because they're unable to, they don't get the treatment that they want, or is it the recurring, the problem reoccurs, they can't get an appointment, so they then just go to get somewhere else to get the recurrent issue treated again? Is that, what's the sort of, you know?
I think it's a combination
okay.
of all of those factors, really.
Okay, right. Okay, so I think I understand the background of it, but that's still, you know, it's quite a long way from, you know, where you started to then launching a company. And so from an entrepreneurial perspective, was that something that you always felt like was your pathway, or was it sort of a surprise to you that you ended up on that journey? How did that happen? I'm always really interested in clinicians who have moved over and done the entrepreneurial thing, because it's not often that being a clinician and being an entrepreneur are necessarily the best bedfellows. So I'm just, how was that journey for you?
Yeah, well, that journey is an interesting journey. I'd always been pushing the boundaries clinically, professionally, within the roles that I was doing. And I was doing research, so I was leading research at the university, the non-medical research at the University Hospitals Western NHS Trust. So I was having a research role, which was kind of pushing boundaries and doing stuff outside of a traditional role. But this idea is an itch that would not go away. The itch that was, you know something, I think we can make a difference to patients, the health system and the workplace by doing this, using this combination of skills, if you like, is boundary spanning to do that. And so I threw all my eggs into one basket. Now, digital was not really on my radar in 2010, 2011, 2012. But after 2013, it became the opportunity, the potential really started to emerge. And so I grabbed that and went down the line of changing to transpose, if you like, that clinical knowledge into something that's usable for population support. That, and I got it right, wrong, but the journey between 2013 to now has been a very different one, and there are key parts of that really did make a difference, really change things.
And one of the big things about GetUBetter, I know, is self-management, or giving individuals access to information and to support in order so that they can take more responsibility for their health, which is, you know, exactly, I mean, I'm you're preaching to the choir in that respect with me. I think that makes total sense. How much of a revolution, or how much of a kind of a change of mindset is that from what was happening, you know, prior to 2013? This concept of if you give individuals more access, then they can look after themselves more. Or was that always there, but there just weren't the tools to do it efficiently and effectively and at scale?
Yeah, that's a really good question. From my experience, it wasn't really until 2018 that the system started to catch up with the idea of using properly tools to solve the problem.
Okay.
So from a perspective of self-management, supporting patients, behavior change, helping patients have the confidence, knowledge and skills to do that. So there is this lag in between, really, where there really wasn't a space or a mechanism for people. And I had conversations with people in 2016, as an example, when the NHS said, right, we need to sustain ourselves and we need to transform ourselves. Right? So and that's a way of really, I mean, it's hard to change large organizations. So it was a brilliant process. And right at the beginning of that, I had a conversation with a CCG.
Okay.
A demonstrated
clinical commissioning group for our listeners.
Sorry,
that's okay.
Commissioning group. Thank you. In my local region, where I was known, I knew all of them. I said, look, guys, this is what we've got for back pain, and I believe this can be integrated into your system to support that. And at the end of this meeting, everybody was in the room, and they said, you know, brilliant. I'll tell you what. In 2.5 years' time, that is exactly what we're going to need.
Cool. And what do you need in 2.5 months?
2.5. Well, 2.5. So there.
Yeah. That's but were they actually was that that sound like that might have been a very accurate prediction in terms of a timeline, though.
I think so, but it wasn't with them.
Okay, right.
But it is now with them, actually. So it's
Right,
come full
okay.
circle. So the company's grown, changed, adapted, and is now producing, this kind of integrated, locally configured, digitally enabled pathways across the system now, and now it's more acceptable. Right. This has really started to gain momentum before the pandemic, but really the pandemic has escalated a lot.
Yeah.
People's perceptions of how enabled we can be digitally.
Yeah, and how enabled we have to be in order to deliver healthcare efficiently and effectively at scale. There's just you have to use digital platforms to the extent that you can, because there are some things that you just physically cannot do digitally. Ergo, you need enough budget set aside for those things, which comes from freeing up individuals from where digital can play a role. So I completely agree. So when you started your back pain in 2013, and then after this one question, we'll come on to all of the fantastic stuff you're doing right now, but I just want to understand this one thing. So when you started your back pain in 2013, or your first iteration of GetUBetter with back pain, how what was the initial reaction, not just from clinicians and from clinical commissioning groups and all those good people, but actually from individuals, from the patients that started to use it? What was the feedback and reactions that you got on the ground?
Well, firstly, the first 2 to 3 years weren't particularly very successful. So we didn't actually launch. It took 3 years for me to get the platform built, build the pathway. So look at that condition journey and say, right, on day one, what is the lived experience for this condition? Mapping that out right the way up to 2 years, and then build the platform to meet it. So we have started off with a business to customer. So naively started off thinking, well, I can sell GetUBetter into the App Store. Right. $2.99. That will, of course, that model really doesn't work very well. And so it really was around 2017, 2018, where, and I don't like this word pivot, but it is really pivot sounds simple. Pivot isn't. Pivot's part of a normal agile process of product development. Yeah. We changed this, become a business to customer. So we changed our platform to enable ourselves to support organizations rather than selling directly to the customer, so organizations to support themselves, but also support patients. And that's when we had our first back pain platform, software as a service, whole organization support. And it was really then when our first customer was with Jim Fenwick from Battersea Healthcare, Ben Wanless from St George's, who's a digital lead in Wandsworth. And Wandsworth is quite a young CCG, quite digitally progressive. They understood at that point the need or the way to support them. And their biggest problem was, from a point of view of a patient's point of view, is they were seeing too many people that didn't need seeing. Right. They had a problem that their physio, everybody was being referred to physio because there weren't FCPs. And they had so many people that actually they just gave a leaflet to. Right. Right. That had no support between, during, or afterwards. And so this group of GP Federation, the CCG, and Ben at St George's, who is amazing and is very digitally agnostic. So he's very fair about which digital solutions he might choose. We worked with them to build them a Wandsworth version of our platform to integrate it in there. So we went to our first CCG meeting. We said, right, we're going to do this at 2 GP practices and support the physio service. In that CCG meeting, the first meeting, they said, no, we need this across the whole lot. So can you just do this across all 40 GP practices? And so then that platform was built. So we knew we had something right, because these guys had a problem and they couldn't support the patients. Now, the patients, from the patient's perspective, some loved it, some hated it, some didn't, some thought they were being fobbed off. Okay. That's fair enough. And so we worked very closely with Wandsworth to learn, understand, develop, and change it, and help to support the clinicians to give it to the patients, and the patients to get onto it, and for the patients to understand why on earth they've been given this, and it isn't a fob off. It's part of your service. Yeah.
I think, sorry, I was going to say, I mean, look, I've done a fair amount of sport in my life, and, you know, been in and out of different physios, and, you know, there is an element where the physio appointment, you kind of psychologically want the physio to fix it, right? But then actually the physio appointment's only 20 or 30 minutes or whatever it is, right? So sort of actually what matters is that you stick to whatever the program is, but the program, there's no reason, like the physio will demonstrate the exercises and what you need to do in the session, but there's no reason why you couldn't access that digitally after the fact and to check on them. And actually you might want to, right? Because you can't remember what happened. I mean, a really good example, just me personally, I actually had back pain about a year ago, you know, small children running all over me, you know, just my back just went, and I went to the physio, and she actually basically, she had me do these exercises, and then she basically videoed me with my own phone so that I had a video of these things on my phone afterwards, right? Which is kind of just a sample of one indication of why a service like yours might make some sense, right? Particularly if it's a complex issue, you've got people with certain other, you know, issues that they're dealing with who maybe can't remember the things, you know, it's not like you can draw a diagram on a piece of paper, right? So anyway, I was just sort of as an aside there. So I totally understand. So let's move to now where what would be really helpful, I think, is from a user's perspective and a clinician's perspective, walk us through what they see with GetUBetter, you know, and explain to the listeners how what GetUBetter is, how you would explain it, and you know, what as a user or what as a clinician they might see.
Okay, yeah, sure. So GetUBetter is a digital self-management platform for all common musculoskeletal injuries and conditions, such as back pain, back and leg, neck, knee, shoulder, lower limb, soon to be a community pelvic health pathway. And our platform and patient-focused app is integrated across the whole care pathway and is made available to patients wherever they enter it. An emergency department, GP practice, physio department, urgent care centre. And we provide this integrated, but crucially, locally configured content for patients that digitally enables a pathway from the beginning right the way through to the hospital. So our app's designed to support patients to trust their recovery, self-manage, and have the confidence to utilize less healthcare resource.
Right. So effectively, they can take more control over it themselves, and they don't keep going back to say, oh, I've got this issue. They actually have the resource that they can turn to as a first port of call.
That's right. And if you're a clinician, you come and see me with your back pain at the GP practice, but actually before you've even got there, the GP practice with the e-consult, so that the system might say, actually, why don't you download your local Wandsworth, Kingston, Bristol, Gloucester lower back pain pathway. And this pathway will support you day by day. And by the way, we do want to see you and we'll advise you when to come back and see us. And by the way, we will support you the whole way through your journey, and we'll connect you, if needed, to local physio, to local treatments and local services. This is part of, for you, for your local care pathway. So before you've even gone to the clinician, you can get access to a local care pathway. The benefits of that are that you can access it 24/7. So you can do it on Sunday night at 10 o'clock at night, and you get access to local content. And the content and the journey you go through as a patient, you don't know the difference, but actually structurally behind the scenes from a healthcare system, it's different for boroughs within an integrated care system. So an integrated care system is a large super CCG, clinical commissioning group, that has scooped up the other places within it. So if you take our area where we're doing quite a lot of work in southwest London, that includes Wandsworth Borough, Kingston Borough, Richmond Borough, Sutton Borough, Croydon Borough, and Merton Borough, all with large populations, all with different processes. So if you're in Wandsworth, you get linked to the Wandsworth app. It's standardized to the ICS, the integrated care system, but it's configured to that area. And if you're in Kingston, you get the Kingston. So as an example, if you're a patient with back pain And we give you a tool that's designed, a stratification tool, a tool that's designed to say, look, you really will benefit from self-management. You need to see a physio. Actually, we're recognizing some risk factors. Let's get you some CBT, some support and physio.
Yeah.
In Wandsworth, we're able to deliver that at the right time based on what they want, and the patient answers the question. And then we say to them, right, actually, we're going to refer you for physio, right? So if you're in all of those boroughs, if you're in Wandsworth, we send them to the physiotherapy single point of access, and that's the structure they've got set up. Yeah. In Kingston, if you live in Kingston, we don't say that. We say, right, for you, let's get you booked in to see the first contact physio at your GP practice, because they need to have a look at you. Right. If you're in Sutton, we say, right, here's a telephone number. Why don't you phone, leave your number. Right. Somebody will phone you back in 24 hours. And if you're in Richmond, we just send a referral straight to the physio department. Right. And that's how GetUBetter works. It's
completely specialized as to whichever area you're in.
Yes. And and so is some of the content too. So we have 3 types of pathways in our platform, and this is where we're quite unique. We have a condition pathway, which is the lived experience. That's what I was talking about, my first idea, that lived experience of a condition from day one, an acute injury, right the way through to long-term conditions. And we take people on a timeline. So you would log in at 4 weeks and say, right, you're 4 weeks in a back pain pathway for Wandsworth. This is the stuff you need to be thinking about. Here's the physical, mental, social, behavior change. Here's all the content you need to get better or support yourself. Then what we do is we do the clinical pathways. We say to the organization, right, how do you want people to move through your system? Brilliant. So we configure that, and then we configure it to local regions. And then we say to the health system, say, right, who goes to the emergency department? Where do they go? Who goes to the GP? So that we configure the health system, and that might be physio, so automated referrals to physio. It might be automated referrals to other areas. But then we include the social care, because social care is a massive area. So housing, unemployment support, all the bits, the determinants of somebody's well-being. Yeah. And then we put in the public health. So if there's an osteoporosis class, as there is in Kingston, and somebody's over 60 and they're female, we say, look, do you know there's this really great exercise and osteoporosis class here to support them?
Okay,
right?
So it's way more than just physio. I mean, there's a huge amount that goes into it. It's really like how do you describe it as a self-management platform, or how do you talk about yourself now?
Yeah, we talk about ourselves as a digital self-management for all common musculoskeletal injuries and conditions. That's our thing. It's all common musculoskeletal injuries and conditions. And we describe ourselves as a platform designed to support the health service, the patients, and people returning to work. So it's not just about triage. So this is the thing. So it's not just about triage. It isn't just about triage or exercise prescriptions. That's the physio element to it. It is actually a whole pathway approach. That's what we're trying to achieve. And that includes, by the way, triage, symptom monitoring, keeping people safe using stratification tools, outcome measures, questions, navigating, and ongoing symptom monitoring, because that's important, especially with the long waits that we have or people are experiencing. It's about recovery. It's about day-by-day recovery for that condition that responds to how the patient's feeling. So all of our content about this journey that the patient goes through is provided depending on how they're feeling. So if they're getting worse, we provide content that's supporting somebody going downwards. If they're staying the same, we provide content. If they're improving. So we really provide things on a timeline, how patients are feeling. Then it's about automated referrals. So we can connect patients to treatment services. And then it's about rehab. So when patients are needing rehab, we connect them to rehab. And as an example, we are partnering with Escape Pain, providing a snapshot of their 12-week program for patients and making it available and automatically referring to them when appropriate. And this is how digital technology like ours can support the whole pathway. Because when somebody goes for 15 weeks and they have got back pain, why are they not being given access to the local rehab program that's there? And then we onboard the program onto our platform, make it available to patients. They have a very clear idea of what happens before, during, and afterwards, crucially. And then we support them to deliver their service. And we can work with other other parts of an organization that might have a pain. And really great, because there's so many amazing local developed, very creative, very innovative programs for musculoskeletal conditions, and we're able to capture them and put them in and deliver them locally, digitize them, deliver them, providing that access to patients.
I think that's fantastic. And I know that you've had obviously pretty stratospheric growth over the last 12 to 18 months. And so how widely available is this platform? And if I'm somebody that has back pain or has something, how do I get access to it, or would I get access to it?
Yeah, so it's available. Our customers are integrated care systems, NHS organizations, primary care networks that are looking to digitally enable their MSK pathways. So if it is purchased for an area, commissioned, purchased for an area, we then at GetUBetter, our team work with that organization, a small team, clinical leads, IT leads, project managers, to capture their pathways, build it, validate it, and then deploy it. And then it gets deployed across the area. Then anyone can get access to it.
For free, of course.
So via prescription or via self-referral. So it really does depend on the areas. Now we're fully deployed. We're fully deploying across Southwest London. We're in the Southwest, so we're Bristol, North Somerset, South Gloucestershire. We're providing it to support all 12 physiotherapy services in Somerset, and we're in quite late discussions with lots of people about.
Yeah, I imagine.
Because right now we have a solution that solves quite a lot of problems whilst enabling patients to change their behavior and self-manage.
Yeah, I think that's key. So it's the combination of solving urgent problems that we have now, but actually it makes sense anyway. Even if there weren't such urgent problems, this makes sense anyway, doesn't it?
Yes.
Right.
Yes, it does. It does. And what we've seen is, and you might have seen this too, Steve, I don't know. What we've seen is this kind of siloed pathways where you have self-management, you have GPs, you have urgent care, you have physiotherapy, you have, and technology is often solves one bit of the problem in a silo. And what that tends to do is literally automate a referral and put somebody in another silo.
Yeah, it makes it quicker to just move the thing on to the next person, right?
That's right. So, and that happens everywhere. And then the patient says, look, you've got to download this triage app, you've got to download this app for physio, you've got to download this app over here. So what we've tried to do, what we have done, not tried, we are proving that it is really successful. I can talk about that in a bit. But
yeah, I hope so.
We're demonstrating you can have an integrated whole end-to-end approach to a digitally enabled pathways, and we're demonstrating it is working.
That's great. No, and so let's on that note, how talk us through how you evaluate the success, either from a metrics perspective, but I'm really interested because I'm sure, look, just like I would imagine lots of people listening, if not most people listening, have some story about, oh, I had back pain, oh, I got injured playing football, like me, like I did earlier in the show. Like do you have some kind of individual case studies or examples of how you've helped people? Because I'm sure that you do, just because this issue is so universal. I mean, we've all struggled to get a physio appointment, right? I know what you do is not just physio. I'm sorry to focus on that, but I think we've all been through that pathway. So so tell us about how successful it is.
So our journey, just briefly coming back to where 2018, we applied for what is called a small business research initiative feasibility grant from NHS England, and we
one of those nice catchily titled grants.
Yeah, really easy. Essentially, it's run by NHS England, supported by the academic health science networks that are designed to foster technology to be developed that works for the NHS, right? So they said to us, right, lively back pain, go and do the feasibility of putting multiple conditions and bespoking it to multiple areas. That would really work for us. So we did a piece of work that did that, and we were successful. Once successful, you get invited to phase 2, and phase 2 is a much bigger contract. And so we were successful for phase 2. And phase 2 was really about building integrated digital technology for musculoskeletal conditions in primary care.
Right.
Hence, GetUBetter is about to start to integrate into EMIS.
Well, cool. Congrats. So
So
that's a big deal. So for those people listening that don't know, EMIS is effectively the operating software for 70+% of GP surgeries in the UK. And integrating it with it is a huge step for any company that wants to work with primary care, aka the GP network in the UK. It's a huge step.
Yeah, that's taken about 8 months to achieve, but we are there. So a patient in a GP practice, now the GP or the first contact can look at it and say, right, Steve, his back pain's got better.
Right.
Steve's now actually preventing and has gone to book onto this prevention course. You know,
right.
So when you go to GP goes, don't worry, I understand you're using the Wandsworth back pain app, and so it really connects.
So so my usage, just to pick up on that, if I'm using the Wandsworth back pain app and I go to my GP, my usage or my sort of feedback through that app will appear in his system via EMIS, his or her system via EMIS. Is that right?
Into the notes, that's right. Yeah.
That's awesome.
But that's a very tiny amount of information because GPs are so busy. So
it's not like an audit log, but it's still really cool.
Yeah, and that's a co-design piece of work. So this SBRI big contract that we got enabled us to do 4 things, and this is coming back to your evidence question. That's why I'm going to come back to that. So it enabled us to develop, integrate into EMIS, build the platform, make it work, CE marked, get it ready to scale into the NHS, and evaluation. So part of it was to properly evaluate independently, GetUBetter in the real world.
Right.
So that's what we were able to do. And by this point, we were in 65 GP, 70 or 80 GP practices. We had tens of thousands of patients. We were able to get lots of information about the patients. And so we worked with the Health Innovation Network, which is an academic health science network, and they've got a digital evaluation unit. So we partnered with them, and they did an independent, nice digital health technology framework, another easy word, but there is a nice digital health framework for evaluation of digital technologies that now feeds into this the NHSX digital technology assessment criteria. So it sits in there as, have you got this nice evaluation? So we've done this nice evaluation independently on real world patients. And the things that we can find, the things that patients like the most, so things that patients like the most were the app reduced discomfort, pain for 7 out of 10 users.
Wow. That's cool. 70% of people had reduced pain.
Yep. 86% said, this app is easy to use, which is amazing given that it's on a phone, and we're dealing with the whole population. We're not just dealing with those digitally enabled. We're trying to get this out to everybody. And 71% believed it helped them to self-manage. So 7 out of 10 people had a belief that it helped them to self-manage their condition, which is, for me, is the most exciting bit.
Yeah, that's awesome. Given that, I think we have to understand that effectively this was compared to 0, if you like. So if they weren't doing this, there was no self-management, there was nothing.
Or
right. I mean, okay. And there's like one of those line diagrams of a leg in the air, and it's sort of so I think that's phenomenal when you look at what you could if 70% of the 90 million people that are currently stuck on, that are currently going through GP surgeries with musculoskeletal issues can self-manage. I know it's not quite that simple, but broadly, that's a huge relief to the system.
Yes, that's right. And actually, musculoskeletal conditions are a condition. And if you can help people while they're experiencing it, that's got to be a good thing, because they can get back to work, they're happier, they're with their family, they know what to do, they have all the things to change behavior. And we worked with the University of the West of England quite a lot on this behavior change. It's been one of the key things about GetUBetter that is so important. What is it about our platform that helps people we know now, and we're publishing some papers coming out. It's in the Journal of Formative Medicine. It's just in peer review at the moment. We're publishing the results. But people, if you talk about the patients again, they say that the app, they would say to us, look, this has improved my understanding of my recovery, and that's a key goal. It helps me develop relevant skills to manage my injury. That's got to be a key goal. And interestingly, a lot of them say, look, this is a great alternative to face with my GP for my condition.
It's not like people desperately want to go to their GP to talk about their back pain, right? I mean, it's sort of, I don't think that's not a burning desire for people with back pain. They just want to get the back pain sorted as quickly as possible. So anything that can allow them to do that would be, I mean, you know, it might take even if you're lucky, it might take a week or 2 weeks or 3 weeks to see your GP for anything, really. So, you know, you might as well crack on with this in the meantime and see what happens. And it's going to, you know, what's your other option? But I mean, if you don't have that, then there is no other option. So no, I think it makes total sense.
That's right. And yeah, that's right. And we're helping to give people access to stuff. And interesting what patients say, which we were quite interested in, was, you know, I have to travel to go and see my GP when I'm in bucket loads of pain. I've got to get my bus. I've got to travel. I'm uncomfortable. I can hardly walk. I've got to go to my GP. So they're saying, actually, this provides me access. You know, this is giving me access to stuff to help me. So thank you very much. And what the clinicians are saying, so the evaluation was multiple fold, really, was the clinicians were saying, look, they find it easy to use in the real world to give to their patients.
Practical.
They like the fact it's a certified medical device. That gives them reassurance. And they like the fact that it connects patients to local treatment and services and automates referral. So the start back stratification tool, which is supposed to be mandatory for back pain across the NHS, it's supposed to be, takes 10 minutes to fill out. But if you've only got an 8-minute appointment, how are you going to fill out a 10-minute?
You're not going to.
No, I mean, so why don't we just do it digitally? Why don't we just do it digitally? The second time we open the app, it says, right, your GP practice, because it's down to that level, Merrywood GP practice, could you just fill out this form? It'll take you 2 seconds and it'll help us to navigate you where you need to go. They fill it out and they go, look, just keep using the app. You're doing really well. Keep using the app, use the symptom checker, follow the physical advice. Or it says, look, we've just referred you. We've done it. You will benefit from it. We've referred you here to the physio. They've got your referral. Here's their number. Call them up if you need to wait. So the GPs then go, right, I can have the confidence that this follows the predefined standardized pathway. And then everybody gets an equitable journey because you standardize care.
And I think the point that you made there that I want to highlight is that you guys have gone down to the effort of obviously being CE marked as a medical device, which I think is a big step and is certainly not one to be taken lightly. But I feel like potentially, or do you feel like the fact that you've done that has sort of marked you apart from, you know, potentially other sort of, I don't know, get well apps or exercise stretching? I mean, there might be some things around there, but it must give, as you say, GPs confidence that they're prescribing a medically validated, audited solution, as opposed to like, oh, hey, why don't you just check out this website almost sort of thing.
Yes, well, I agree. Not that they might understand what it means, of course, because it's a pretty complicated world of quality and security and safety. But it certainly does give a badge, just like, I guess, more common these days, the Orca app library that gives a badge. GetUBetter is currently at 91% in there. And there's a professional assurance bit of that you can look at, and that really ties down to the evidence, really. And there also, of course, there's the DTAC. So I don't know whether people want to say GetUBetter is DTAC compliant, but that's a process from NHSX to say to organisations, if you want to procure something, they should be DTAC compliant. And what DTAC is, it's just pulling all of those pieces I've just told you about into one certificate. So CE mark, are you CE marked? Do you need to be? Are you CE marked? Do you have a nice digital health technology framework assessment? Have you done an accessibility assessment? Can you demonstrate it? Are you on the Orca app library? Yes or no? Do you, you know, so all the things that kind of we get asked all the time, it's designed to make it easier. It's not quite there yet, but we still get asked the same questions, so it's not being used as it's intended, but I'm sure that will change.
Cool. Well, look, I know that we're kind of wrapping up the show. What is next for GetUBetter in the next sort of 12 months? Because I'm guessing, you know, your growth at the moment is pretty stratospheric. So what's up next?
I guess a couple of things. I mean, the thing that we will be providing, we don't yet provide language. We definitely provide reduced digital diversity by having very diverse content and enabling targeted content for organisations for their subgroups within their population. We hadn't done this because when we spoke to people, they're often the family member helps those non-English speakers, and so the family members were able to use it and do that. So what is next for us? Language for sure, but that will be coming very soon. Secondly, we've repurposed our platform for carers. We didn't think this would work to help people in care homes or people that are looking after people, but I think there's an element of repurposing our platform to really support the digitally excluded group who cannot use technology by supporting the carers. And our early work in the Bristol, North Somerset, South Gloucestershire area, which was actually funded by NHSX, we've been blown away by the response. We've had carers saying to us, thank you, someone is listening to us, and now I can go into my residence and now I can help them. I now know what to do.
I think that's amazing. We spoke about this before the show.
Yeah.
I think it's an amazing thing, which is that it comes out of the insight that carers were almost Googling what to do with people on the fly sometimes when people were coming to them, which is kind of crazy, and a clear indication that there needs to be a solution like GetUBetter that can provide them with validated, official, localized, CE marked advice about what to do.
Yeah, exactly. And so they've been really empowered, and that's really given us a buzz around GetUBetter for our modesty, because we're a bunch of clinicians at the end of the day. So when we find something that really helps it takes it away from healthcare to social care. So we're kind of moving into that social care, healthcare, public health kind of space. So that's really exciting. And the last thing is we're working with a really great bunch down in Bristol, some cardiologists, some crazy cardiologists who are helping us to build a cardiovascular package.
Oh, so cool.
We'll be moving into MSK package, cardiovascular package, and it's not unreasonable for a patient to have multiple comorbidities. So we're doing that kind of work. And the last bit is community pelvic health. So supporting women and men with pelvic pain or pelvic problems that are affecting their lives. And it's a huge unseen problem. We're working with the South West London Partnership to build a whole pathway approach to that. Now, those three things, the carers, the multiple packages, and the community pelvic health, are really exciting for us, alongside reducing digital inequality, because we're always working to find new ways to reach hard to reach groups. Great.
Well, look, on that note, Carey, thank you so much for coming on. Carey McClellan, CEO and founder of GetUBetter. You may already be using it, if you're in one of the areas lucky enough to have it commissioned. I'm sure that, within 12 months, it will be all over the UK, but you guys are on a rocket ship. And thank you so much for coming on. You guys are doing some fantastic stuff. So again, really appreciate you coming on the show and telling us about it.
Thank you, Steve, and thanks for the invite. It's really nice to be able to share this and discuss with you. So thank you.
Great. Thank you, everyone, for listening. See you again next week.